Hey everybody, and welcome to your instructional video on knee CARs, as well as a little discussion on the patella. Now, a few things about CARs in general. Number one, we never want to push into pain. So if you experience some discomfort, it doesn't mean don't move. It just means make your workspace or your movement pattern a little bit smaller. Number two, we really want to isolate the joint of interest. So in the case of the knee, we want to be aware of what's happening above the knee at the hip and below the knee at the ankle. And we'll use a technique that is just referred to as the block and lock method, which is stabilizing the hip so it's not moving in and out, and stabilizing the ankle so that it's not moving up and down or in and out. Lastly, we want to be sure to irradiate, so we'll create that light tension across the body from head to toe as we try to move through our CARs. Now, when we talk about the knee, at least when I talk to clients about the knee, what I hear a lot about is I have limitations in flexion and extension. And I say, okay, that's great. How does your knee rotate? And most of them look at me like, what are you talking about? Rotation is the primary movement of all of the joints, as we're learning, aside from the spine. So it is the primary movement of the knee. If you think of it like a wet towel, you can scrunch a towel up and you get a lot of the water out of it. But when you rotate it, you create that torque and that tension in the center, it really pulls or drives the rest of that water out. Knee tissue is very similar. So what we're going to do is assume a seated position. You can be on the floor, a little elevated like I am, or even in a chair. We're going to put the right ankle or right heel down into the floor. I'm going to block my hip by holding behind the knee. You can also go into a little bit more intense position if you want to really lock it in place. So we've blocked the hip. We're going to lock the ankle by pulling the toes up, feeling tension through the shin. Now in this position, I'm going to try and rotate the knee, which means I'm going to pivot off of the heel, and I want to watch what happens to the tissue beneath the kneecap. Now you can either focus on keeping the kneecap stationary, or you can place your hand slightly below the kneecap and watch as that tissue hopefully goes to the outside. So this is external rotation of the knee. All of that tissue and the tibia rotate so that everything is to the outside of the body. From here, I can pivot on the floor and bring it all back towards the center of the body, which is internal rotation. So we'll do a couple more of these together. We'll take a little breath, light tension across the body, externally rotate, internally rotate, externally rotate, and internally rotate, and relax. Now, if you found that it doesn't move a whole lot, that's okay. If you found that it's a little choppy in its movement, that's okay. Both of those can actually be improved just through practice. What we don't want to do is push into pain, so just always keep that in mind. Now, we do want to incorporate flexion and extension into our CARs movement. So what it will look like if we do one full articulation in both directions is that we'll start internally rotated. I'm going to externally rotate, raise it up a little bit. What I don't want to do is straighten the leg. Okay, as long as the knee is bent, I can rotate the knee. In this position, I'm going to internally rotate. I'm going to flex in, change direction, take it up, externally rotate, flex it in, internally rotate, and that would be one full articulation. And what we'll do is we'll do two articulations on the right leg, and we'll do two articulations on the left leg. So again, we'll start with the heel down, take a breath, squeeze and pack air in the lower abdomen, work it down to the toes, up the torso, out into this leg. Everything is nice and tight. I've got a good block and a good lock. I'm going to start internally rotated. I'm going to begin by externally rotating the knee, keeping everything stationary. I'm going to extend up, internally rotate, flex in, change direction, extend up, externally rotate, flex in, internally rotate, change direction. Number two, externally rotate, extend up, internally rotate, flex in, change direction, extend up, externally rotate, flex in, internally rotate, and good, very good. We'll go to the left side. Same thing, take a breath, pack air in the lower abdomen, block the hip, lock the ankle, feel tension here. Everything is nice and tight. We're going to start internally rotated. We're going to externally rotate, extend up, internally rotate, flex in, externally rotate, and change direction. Internally rotate, extend up, externally rotate, flex in, internally rotate, change direction. Externally rotate, extend up, internally rotate, flex in, change direction, extend up, externally rotate, flex in, internally rotate, and good. Nice job, everybody. All right, so a little discussion about the patella. If you were to extend the leg all the way and totally relax the leg, now you can actually do something with the patella. When the leg is fully extended, the patella jumps down into its little joint cavity, which ultimately locks the knee in place. So if I were to say I want to rotate my knee, what I'm actually doing, and you guys can probably see the tissue up here, is I'm rotating at the hip. Now, the patella should move, and that's something that you should take a look at. So when I look at my patella, I'm going to take my thumbs on either side, and I'm going to gently slide it to the left and slide it to the right. So mine moves pretty well. I've spent some good time with my patella. And what we want to do is make sure that it moves well in both directions. Now, what does moving well mean? To me, it means if you were to cut up your patella into 4 quadrants, you should be able to move 25 to 50% of the width of your patella to the left and 25 to 50% of your patella to the right. So if I scoot it across, looks pretty good that direction. If I take it the other way, looks pretty good that direction. Also going to take it forward and take it backwards. Now, if you find that there are areas that are a little bit limited or feel a little bit crunchy but don't have any pain associated with them, then a simple thing you can do is find that area. We'll pretend that it's kind of in this quadrant for me. I'm going to push my patella into that area and I'm going to hold it for 2 minutes. That force that you generate, or that you are generating, will create a response in the body, and that's how tissue adaptation takes place. So with practice and consistency and investment in your joint and health and mobility, eventually your patella will be able to move a little bit better through that space. All right, so let's go ahead and do the other side. Since we did the first side, I'm just going to go ahead and take it to the left, take it to the right. Seems to be moving pretty well. Take it to the back and the front a little bit. You can take it in circles, whatever makes most sense to you to just really explore your patellar space. All right, so that wraps up our instructional video on knee cars and our discussion on the patella. Remember, rotation of the knee is the primary movement of the knee. And if you have any questions about knee cars or the patella, don't hesitate to reach out and let me know. Otherwise, I hope you guys are doing well, and I will see you soon.